So, hi everyone. Today we'll be discussing a journal club presentation on the topic local injection of amphotericin B, a novel used in the treatment of fungal maxillary sinusitis. So, this article is present in the International Journal of Oral and Maxillofacial Surgery, published in 2023, and it is a case report by V. Agarwal, K. Kumia, A. Gupta, and V. Singh. You can subscribe this YouTube channel for further journal club presentations, and I have also uh, put my Instagram handle on the bottom right. So, coming to the introduction part, so mucormycosis is an invasive, life-threatening fungal infection. So, these cases rise in a high manner in post-COVID-19 era. Standard treatment was surgery and systemic antifungals. So the rationale for the study was the systemic antifungals have poor penetration in necrotic tissue. So the surgery is disfiguring and affects the quality of life. So a local amphotericin B injections may reduce need for surgery. So here we can see an liposomal amphotericin B 50 mg, and it is available as ambisome. The objective of the study was to evaluate local amphotericin B injections as a conservative treatment for maxillary fungal sinusitis, potentially avoiding extensive surgery. So, presenting the case one. So, the patient had a chief complaint of pain in left cheek region for 7 days. She also had a history of left rhino-maxillary COVID-associated mucormycosis in June 2021, which had been managed with endoscopic sinus exploration and systemic liposomal amphotericin B. Total dose was given 1000 mg, followed by oral posaconazole for 2 months. The patient's medical history revealed that she had been diagnosed with post COVID diabetes mellitus, but her blood sugar levels were currently controlled. So, on examination, face was apparently symmetrical with no evidence of any swelling, paresthesia, and mild tenderness with evident in upper lip and infraorbital region on the left side, tenderness in tooth 2-1 and adjacent edentulous alveolar region extending up to 2-5. Necrotic bone with mucosal erythema was evident in the region of 2-3, 2-4, and 2-5. So the CT reveals soft tissue thickening involving the left maxillary sinus and osteolytic changes involving the left maxillary alveolus, suggestive of residual invasive fungal disease. So this is the pre-treatment CT scan of a coronal section showing necrotic bone on the left side in the region of anterior maxillary alveolus. So the treatment plan was, as the patient had already undergone extensive systemic antifungal therapy. Three local amphotericin B injections were planned on alternate days. 1 milliliter of 3.5 mg per ml solution of amphotericin B deoxycholate infiltrated supraperiosteally in the vestibular and palatal region at the site of osteolysis with an insulin syringe. Bone nibbling of the exposed necrotic bone was done using rongers. Then the patient reported with 50% reduction in pain after the three injections. A further 10 local amphotericin B injections were administered at weekly intervals. There was complete removal of the pain and paresthesia, and the patient was extremely satisfied. No disfigurement of the alveolus or face occurred during this treatment. So the follow-up was a subsequent radiographic evaluation at 3 months, 6 months, and 1 year follow-ups revealed restoration of the cortical outline of the floor of the nasal cavity and a mild reduction in the size of the lesion with no further signs of disease progression. So here we can see the three coronal sections. First one being the pre-treatment CT-PNS coronal section showing necrotic bone on the left side in the region of the anterior maxillary alveolus. The second one shows the section at 6 months of follow up, and the third one shows at 1 year of follow up the CTPNS computed tomography of the paranasal sinuses. Then coming to the second case, so the patient had a chief complaint of ulcer and a burning sensation in the left upper jaw region following the extraction of teeth from the same region 3 weeks previously. So the patient was a 79-year-old female and reported in March 2022. She reported a history of COVID-19 2 months earlier. Then on examination, paresthesia was present on the left side of the infraorbital and upper lip region Intraorally, a diffuse swelling was noted on the left side of in the alveolar region with unhealed extraction sockets of 21 to 25. It was soft in consistency and tender on palpation. Exposed yellowish necrotic bone of an irregular shape was visible in the posterior parietal region on the left side, measuring approximately 7 mm into 5 mm. Then the medical status was that the patient's glycated hemoglobin, that the HbA1c of 7.5%, was diagnostic of the diabetic status, and the potassium hydroxide mount was positive for mucorales. She was referred to the endocrinologist who advised dietary modifications and exercises along with adjunctive metformin monotherapy at a dose of 500 mg twice daily. At the follow-up visits, her blood sugar levels indicated a controlled diabetic status. Radiographic examination revealed soft tissue thickening in the left maxillary sinus, along with osteolytic changes involving the left parietal and maxillary alveolar region. On the basis of these clinical laboratory and radiographic examinations, a diagnosis of COVID associated mucormycosis was made. The patient was administered 10 local amphotericin B injections at the site of the disease using the same method as in case 1. The 3-month follow up, the patient reported complete resolution of the clinical presentation. There was significant reduction in burning sensation. The occasional mild tenderness was reported in the 2-4 and 2-5 region. The follow up CT scan performed at 3 months did not reveal any signs of progression of the disease. So this is the sequential clinical presentation and radiographic presentation of the case 2, showing complete resolution at 3 months of follow-up. A pre-treatment clinical presentation is the first image. Then in the B part, we can see after local amphotericin B injection. In the C image, we can see that after local amphotericin B injection. And in the part D, we can see after a local amphotericin B injection. Then again in the part E, we can see the same. Then coming to the CT scans or the which are seen in the figures G and H, the arrow demonstrates the changes in the bone is the maxillary anterior alveolus. So the techniques of local amphotericin B injection showed that amphotericin B deoxycholate 3.5 mg per ml. Liposomal amphotericin B can also be used, but that was a little expensive. So being a less expensive option, amphotericin B deoxycholate was used, and it was also easily available. Supraperiosteal infiltration at osteolytic sites, bone nibbling of the necrotic bone, weekly or alternate day injections. Coming to the advantages of local amphotericin B, it has a better tissue penetration, avoids systemic side effects, preserves the facial structures and functions, used when useful when surgery is delayed or impossible. So discussion. Rhizopod spores are and germ tubes attach and injure human endothelial cells. Direct contact between the fungus and the endothelium, followed by phagocytosis of the fungus, causes this damage. Hence, the medications administered systemically may not reach the diseased tissue in the optimum concentration. Additionally, due to its strong protein binding capacity and huge molecular weight, amphotericin B diffuses slowly into the tissues. Then, coming to the discussion part, I will be comparing different articles on the same issue. The first one being the outcomes of transcutaneous retrobulbar injections of liposomal amphotericin B in post COVID 19 rhino-orbital cerebral mucormycosis. So, this was an article by Ramamurthy et al. In the Indian Journal of Ophthalmology and published in March 2022. So, this study evaluated transcutaneous retrobulbar injection of amphotericin B in 82 eyes with post-COVID rhino-orbital cerebral mucormycosis using a scoring system to guide treatment. Significant improvement was seen in mild and moderate cases, while severe cases showed limited response and required surgery. So, the transcutaneous retrobulbar injection of amphotericin B was found to be safe and effective, especially in early disease. The scoring system helped access severity and guide management. Then coming to the second article, so the retrobulbar injection of amphotericin B in patients with COVID-19 associated orbital mucormycosis, a systematic review. It was an article by Sharifi et al. In the Ophthalmic Plastic and Reconstructive Surgery, published in October 2022. So, this systematic review analyzed 13 studies on retrobulbar amphotericin B injections in COVID-19 associated orbital mucormycosis, covering 647 cases. The treatment showed a high globe salvage rate. So, what is the globe salvage rate? So, the preservation of eyeball or not disturbing its contents during any sort of surgery or treatment is known as a globe salvage rate. So it showed a high globe salvage rate of 95% and helped reduce major ophthalmic symptoms with few transient side effects. The overall orbital accentration rate was 14.9%. Retrobulbar injections appear to be a relatively safe vision, preserving alternative to a more radical surgery. Then coming to the third article, so it was an article in the journal de Mycologie Médicale, the volume 30, issue 3, and it was published in September 2020. So the title was as follows: that the mucormycosis treatment recommendations, latest advances and perspectives by Brunet et al. So, the mucormycosis is a severe fungal infection with high mortality, especially in immunocompromised or diabetic patients. Current guidelines recommend ribosomal amphotericin B with surgery as first line treatment, while isavuconazole and posaconazole remain second line options. New antifungal agents treatment approaches are under investigations but lack proven efficacy. Future strategies, including novel drug combinations and administration routes, offer hope for improved outcomes. Then coming to the another article, so it was in the Willis online library. So the orbital maxillary mucormycosis and the surgical approach to treatment, perspectives from a maxillofacial surgeon. So it was published by Rapidis et al. In September 2009. So, rhinocerebral or rhinos orbitocerebral mucormycosis mainly affects immunocompromised patients, especially those with uncontrolled diabetes. The infection starts in the sinuses and can spread to the palate, orbit, and brain, causing severe tissue necrosis. Early diagnosis, correction of underlying conditions, and prompt aggressive medical and surgical treatment are crucial for successful outcomes. Surgical intervention often involves extensive resection of the infected facial and orbital tissues. Then coming to the limitations and considerations, so this article had a small sample size and individualized treatment planning and the possible local inflammation. So the key takeaway message was that the local amphotericin B injection is a promising adjunct for or alternative therapy for maxillary fungal sinusitis, preserving tissues and reducing morbidity. Thank you.